and good evening. It is 6:02 on the clock. Claudia here from the Beat London Breakfast Show. But this evening we have something very, very special. The Beat London, in conjunction with the NHS and Brent Council, are here to discuss winter wellness, and we have an amazing panelist and the public welcome to get involved in the conversation. And you can do so by calling in on 0208 963 9566. I'll go again so you can take the number down. That's 0208 963 9566, or by heading over to our socials on the Beat 103.6 FM across Instagram, Twitter, and Facebook. So we have an amazing panel once again, and I'd like for our panelists to introduce themselves. So first up, I'm going to call Councillor Neil to introduce yourself.
Hi everyone, I'm Councillor Neil Nerva. I represent Queen's Park Ward in Brent, and I'm the Cabinet Member for Public Health, Culture and Leisure. Thank you.
Amazing, thank you. Nigel, would you like to go ahead?
I'm Nigel Kare-Silver. I'm a practicing GP in Brent, in Gladstone Medical Centre in the Dollis Hill area. I also represent and lead a cluster of 6 local practices called a PCN, also within Brent. Thank you.
Amazing, thank you. And do we also have Dr. John Licorice with us? No, not yet. Okay, not yet. Okay, that's completely fine. We'll be having this conversation right up until 7:30, and we tend to go over because it's such a great conversation. So feel free to tell a friend, get involved, and to get involved yourselves. So first things first. What is winter wellness, and why is it so important for us to be discussing this? Why is it so difficult this year round? Would you like to go ahead?
Yeah, I think I'll start off and say we all sometimes get winter blues, don't we? But I think this year it's especially difficult because of the pandemic. Recent uncertainty around the variant, the fact that some people feel able to go out, others less so, and we've got the economic backdrop. I know we've got Pat on from advice for renters, and some people have had a really hard time recently financially, and I think there's a lot of uncertainty with that, which makes December this year more challenging perhaps than we've had in previous years. There isn't the even the security of the furlough, so some people have done okay, but others less so, and we can talk about the support which the council and NHS have got available a bit later.
Perfect, thank you. Nigel, is there anything that you'd like to add to that?
Yeah, I think there's a lot going on this winter. The country's in a bit of turmoil with all the sort of Brexit and lorry driver shortages and threats of poor food supply chains and everything else that we just don't know how will come about. We had the awful trouble with the petrol only a few weeks ago, which now seems to have been overcome. And I think everyone's fed up. Everyone's fed up with COVID and masking and isolation and closed doors and being locked indoors at home. And we're getting a bit complacent that it's all over. We're getting a bit complacent that COVID's a pretty minor illness and you'll get over it. And new variant, we just don't know. New variant's very scary. But with COVID, there are still quite substantial numbers of people getting ill and getting very ill and going to hospitals and dying. And we look at the news every day and we think, oh, well, the number's 60 or 100 or something. And that's not bad. Because back in December, it was about 1,000 a day or 1,200 a day. And it's not bad compared to that, but there are people losing their lives because of COVID. And it's winter, so all the other things which come along in winter, all the viral infections, all the colds, the snotty noses, they're all worse in winter. People drive worse in winter. There's more accidents on the road. So it's all very scary this winter, I think. Hopefully we'll get through it, but it seems to come early. It was a very sharp, cold day yesterday. Picked up the weather today, but we don't know what's happening over the next few weeks. Scary times.
Yeah.
Yes, I can agree with you. I have felt like it's been really cold, and I tend to feel like it gets cold when we get into the new year. But this year, it's like it's hit us really early. So you've mentioned how, obviously, when it comes to winter wellness, and especially with the new variant, that people need to be wary of staying well this winter. I guess the key question is why would anyone need a booster jab if they are already double jabbed?
The jab doesn't get into the memory part of the immune system so well. So some jabs get in, you have a single one, and that's all you need for life. And some of them you need boosters on a regular basis because the body doesn't remember the germ that it's protecting you against. And with the COVID jab, it's a sense, and it's still very early days, there's a lot of science emerging on the COVID jab, but there's a sense that it takes, the memory system will last between 3 and 6 months, and we need those boosters. And lots of elderly, lots of vulnerable people in Brent, and a very vulnerable population in Brent with all the different mixed cultures and mixture of people we've got. Very, very highly vulnerable. I can't emphasize enough that people should get that jab done and get that jab done.
And would you say get both jabs, flu and COVID?
Yeah, and we can give both together. Once upon a time, we were a bit nervous about giving them together, and we'd say to have them about a week apart or even a month apart. But those days are over. We've got now a lot of evidence it's quite safe to give them together. Not everybody likes 2 needles stuck in them all the same time. Other people prefer it, have the 2 needles stuck in, that's it, that's all done. But there's no harm doing them both together, and they're both illnesses. Flu's a dangerous illness in itself. Flu kills people every year. Winter deaths in England and the UK go up every year with flu, but we've just forgotten about it. We've forgotten about it completely with COVID because COVID is so much more such a much bigger thing.
Yes, that's correct. And I feel like when it comes to COVID and it comes to the jabs, not just the COVID jab, thank you, Neil, for mentioning the flu jab as well. People have so many questions. So if you've got any questions, feel free to either put your hand up to ask or send them directly to me and I will read them out for you. So you've pretty much answered why and how we can have the flu jab as well as the booster jab. And one thing that was brought to my attention that is some people find that the booster jab, the way it's been named, is quite misleading because booster sort of implies that it's like a top up. Is the booster jab literally a top up from what if we've been vaccinated? Is it a top up or is it an additional?
It's an additional jab. It's an additional jab which we need. The first 2 trigger off the immune system, but then you need that boost for the memory. Lots of questions going on at the moment because a lot of people would have had one jab like the AstraZeneca back in the beginning of the year. There's not much AstraZeneca around at the moment. And most of the vaccines we're giving are Pfizer, and people are saying, well, is it worth my having the Pfizer, or do I need another 3 Pfizer vaccines in order to get the immunity? The science is new and the science is a bit raw, but there's a lot of evidence that this mix and match actually works better than the single vaccines on their own. A lot of questions going on about whether it's safe to have, and a lot of people who do have long-term illness and some long-term severe illness, like living with cancers, living with treatments and keeping going, thank God, keeping going, keeping alive, and saying, I don't really want the booster or the vaccine in case it gets me going. They're the most vulnerable. If you've got a medical condition, which means that your immunity is low, and your doctor should have told you that, either your GPs or the hospital doctors or both, you really, really, really need that vaccine.
Amazing, thank you so much.
It's scary. It's scary because there's a lot on the streets. There's a lot of people who have the vaccine. I was reading something a couple of days back that only 1 out of 3 people who have COVID, carrying COVID, even though they've got it, but they're spreading it. They're spreading it in the shops, they're spreading it in the offices, they're spreading it in where they work, they're spreading it on the bus stops, they're spreading it in their homes to the older and vulnerable relatives. So you've got to be really, really, really careful. I can't emphasize enough.
And so you've mentioned an important stat there that only 1 in 3 people are spreading the virus without even knowing it. What would you say is causing people to spread it without even being aware? Would you say that less people are testing because we're outside now, in terms of we're back at work and things are loosening up? What would you say is the cause for the spread to be so high?
First of all, it's two people out of 3 who got the virus and don't know because they feel perfectly well.
2 out of 3.
2 out of 3. And secondly, there's loads of people who do get tested. Loads of people get tested all the time. Some people for their place of work have to get tested with home testing kits, which aren't great, but they give you an indication. Some people get tested because they feel a bit under weather and want to know what's going on. And some people refuse to get tested because they're frightened if they get a test and it's positive, they're going to have to isolate. And they're working on cash, they're not working on sick leave. And they're scared that if they get tested positive, they're going to not be able to go to work, not be able to earn money, not be able to keep what is across the whole of bread. People trying to make ends meet, and not being able to work for a week on isolation is frightening and scary. But then you could be a spreader, and this is where the risk comes. And I get it, I understand it, and it's trying to balance everything. But you've got to be wary of the people around you. You've got to see that everyone around you's got it, and you've got to take care.
100%, I couldn't agree with you anymore. And I guess that's why we have this new rule where we have to wear a mask, right? When we are in store, when we're on public transport. And I've even received messages from some of my friends today saying that people have actually started to be fined if they've been on the bus and they haven't worn their mask. So maybe that will give people an incentive to take it a bit more seriously. Yeah, and the masks is the biggest protector. And people do get fed up wearing masks. People hate masks. I hate the mask. It makes me sneeze all the time, but you really should. You really got to wear it. And some people get fined, but a lot of people don't. A lot of people think, oh, there's not a problem. There's no one else who's on this train who's wearing a mask, and why should I bother? You need it to protect yourself, whatever everyone else is up to, whatever the train authorities, bus people are doing to fine people. You need it to protect yourself. Perfect. Thank you so much. One big question, which I feel like more people will most likely get involved in, is a question relating to why the take-up of the vaccine is still very low within the Black community. So, we've had a panel discussion before where we were discussing health concerns within the Black community, especially here in Brent. Would you like to answer that question, Nigel? I understand some of it. I don't understand all of it. Okay. I think that some people have got the idea that the vaccine isn't safe. Some people have got the idea from scare stories that the vaccine is being designed to harm people in certain cultures, certain religions, and certain races. And for any of you who've seen the Bond film in the last couple of weeks, that's the story of the film, that you've got to design a virus which will kill a certain group of people and leave others untouched and unharmed. And that message seems to have got out. And whoever is preparing these messages seems to have got it out actually really well and very persuasively to those people prepared to listen. The vaccine is not perfect. The vaccine has some side effects. It does have some risks in people. But if you look at 10,000 people without the vaccine, 10,000 people with the vaccine, regardless of race, religion, ethnicity, whether they're born in England or somewhere else, the 10,000 people with the vaccine do much better. They don't get so much COVID illness. If they get COVID illness, it's much more mild than the other 10,000. And if they do get very ill with the COVID, they still come out better the other end than the people without the vaccine. So the numbers are important. There's always stories of someone's had the vaccine, something's gone wrong. That goes with any medicine. That goes with any medicine or treatment we've got in medicine, because medicine's not perfect. But the general message must be it's a safe vaccine, and certain groups we can identify as being more vulnerable. Brent, last March and April when COVID struck was absolutely horrible. Every day we were getting dozens and dozens and dozens of phone calls of people ill with COVID. There was a lot of chaos. We weren't sure how to treat them. Our hospital colleagues weren't sure how to treat them. Every day we were sending people into hospital. Every day we were getting notices from the hospitals that some of our patients hadn't done so well. Every day we were getting messages about friends, about family who were in hospital and hadn't done so well and weren't coming out alive the other way. It's a really nasty illness because you think, oh, well, I've had it mild and I can survive it. Or I've been around 18 months, I haven't got it at all and I'll be absolutely fine. Or, well, someone in the house had it, granddad had it, and he got through it, and I didn't touch me. I'm immune, I'm immortal. And it's so easy to have that thought process. But there's no way I can look at anyone on this screen at the moment, on the Zoom screen, and in any way say that you're safe and you're not safe.
We haven't got any tests for that. We haven't got any way of knowing that. Everyone must think of themselves as being vulnerable and vulnerable to a nasty lingering illness which can kill and does kill.
Thank you. And I want to, again, plug the socials. If you want to get involved in the conversation, socials are the Beat 103.6 FM across Instagram, Twitter, and Facebook. The studio line is 0208 963 9566. Comment question is, why is the take up of the vaccine still low in the Black community, especially here in Brent? If you have a reason, or if you have anything to share, feel free to call in or hit us up on the socials. So if anyone would like to hand up and contribute to that question and get involved, because I know it's something that we've discussed previously, or it's come up in a previous conversation. We've discussed health amongst the Black community, and I know it's quite sensitive. I can mention previous things that were brought up. So some things that were brought up were lack of trust within the health system when it comes to the Black community. Also delays, I think that was one thing, in terms of not actually being able to seek attention in an orderly manner or in a timely fashion, and not everyone can actually afford to go private. So is anyone that would like to share their thoughts on why the take-up of the vaccine is still very low for the Black community? I have a quick question for Neil and Nigel, actually. You might know this from the top of your head. How long has the vaccine actually been out now? For the first initial COVID-19 vaccine?
Nigel?
Okay. The Pfizer vaccine was the first one available in the world. Yeah. And as much as we might not like Boris Johnson very much, he did manage to get huge supplies for England back in the beginning of December. And the first vaccines were rolled out at the beginning of the 3rd week of December last year. AstraZeneca appeared somewhere towards the end of January and was used widely. Then there were a lot of scares about the AstraZeneca one, especially amongst young people. And now there's very little AstraZeneca in the UK. There's a 3rd vaccine in the UK called Moderna, but the government hasn't bought very much of it. And I've heard there's some in Luton, there's some in Wales, but we don't seem to get anything much of it in London. But it's been going now since the 3rd week of December, and large numbers. August was a bit slow and deliberately because we were all so exhausted. We just needed a break from giving the vaccines all the time. Thank God the numbers were a bit lower at that time as well.
Can I just add?
Yeah, go on.
Yeah, a couple of points. Just wanted to follow up what Nigel was saying. Is as I understand it, immediately COVID was identified at the start of this time 2 years ago. Scientists in Cambridge and other places in Oxford were working on possible vaccines. Yeah, and it's not as if I'm not a scientist. Yeah, but it's not as if this was we've always known that we could end up with a virus such as this, and scientists have been preparing for this, yeah, in terms of vaccine preparation, yeah, both in terms of sequencing what would have to be in the vaccine, but crucially, I think, which has been really impressive, about how you tried it and actually go from a laboratory through to actually having a jab which you can safely give somebody. And I think we have to be really, it's a celebration of science that has been achieved, yeah? How it's been rolled out and how this country has gone, I think it's really sad from being right up there at the beginning in this time last year, in which there was the excitement that Britain was the first country to actually offer a vaccination, through to being very much a mid-table country now. If you look at the data, the rollout has not gone as well as it should have, yeah? And countries like Spain are ahead of us, yeah? There's far better coverage in Spain than there is in the UK. And what worries me is something that Nigel was referring to at the beginning, which is that certain people think we can just continue to live with COVID. And what really worries me is we are living in a country, we're living in a city, we're even living in a borough, where parts of the borough, parts of the city, parts of the country are well vaccinated, and others are not. We know where the virus will want to go. It won't want to go to the well vaccinated places. It will want to go to the badly vaccinated places. And what as a counsellor, we in Brent have known that we can't expect people. I heard on the radio today somebody put in on the machine on their computer, and it came up. You've got to go 35 miles away to get a vaccination. That is unacceptable in a borough like Brent. Real story actually from Somerset in Somerset. And what we have got is not just the provision which Nigel and GPs are putting on through vaccination centres, but we've actually got the vaccination bus. We've actually got the centre opened up this week as a place which people can go on a daily basis. Because something we've picked up in terms of overcoming hesitancy is we need to bring the vaccination to local communities. To the journey, a bit like going to vote. If you say to someone you've got to vote and walk a kilometre, they'll say, maybe not. If you say to somebody the ballots at the polling station's immediately opposite your flat, well, I think you'll go, it's more likely if you're going to vote. Which is why we want to bring vaccination to as many people as possible in their locality. And that's what Brent Council, working with the local NHS, have been doing. We were the first borough in London to have a vaccine bus which could actually tour places, and especially those places where we know there's been undertake up of vaccination. I'd also add that I think sometimes, I feel very confident. I had my booster on literally the anniversary of the 6 months at the Brent Civic Centre. But I am very aware that some people, it's impossible to actually engage them in a conversation. But others, we actually need to take them on a journey to give them the confidence to have the vaccination. And I think that's really important. NHS, the council, and local community organisations are working all together to maximise confidence for people to take up that vaccination offer.
Perfect. Thank you so much, Neil. And this actually leads on to a question that we've just received, which is how can we improve the vaccine uptake? So you've mentioned how Brent was the first borough to actually have a bus that was touring the area and actually remember when this happened. What else can be done to improve the vaccine uptake, especially in the Black community?
Well, we do have a lot of vaccination centres in the community. We've got some big ones, we've got some small ones. I work 1 day a week at the vaccination centre at the School for the Hindu Temple in Brentfield Road. So if you know the North Circular, you've got like Cllr one side and returning on the other side of the road with a big, massive, beautiful Hindu temple. And opposite there is the school. And we have vaccine centres every day. We do about 1,000, 1,200 vaccines a day there. We do a lot. Some of it depends on the turnout and the number of people who come out. Many practices are trying to give vaccines as well. I'm working closely with a practice in Queen's Park, and they're giving vaccines once or twice a week. They're a bit further afield. There are other big vaccine centres in Brent. Going back till about June or August, I can't quite remember when it finished, there was a vaccine centre in the mosque in Willesden, the Willesden Central Mosque, which was very, very successful. It ran several days a week. And also had a lot of support from the council for setting up a vaccine centre called the Lewison Centre off Willesden High Road, which is part of one of the churches in Willesden High Road. And we ran that for about 6-8 weeks over the summer months. So the bus is going out to people, going to do the vaccines in everywhere we can. Big vaccine days in sports stadiums, and in any sort of central area where we can get some shelter and some cover. We're trying to go out to people and reach out to people rather than tell people to go to a special place convenient for some who live nearby but inconvenient for the rest of us. It's a big program, it's a big organisation, it's a lot of people involved, and it's exhausting work. It's rewarding work, but exhausting work, and and we need to keep the momentum going.
Fantastic. And we have another question in relation to the flu jab and the booster jab. What are the chances of the flu jab and COVID-19 vaccine getting mixed up? And I know some people who will take the flu jab but not the COVID vaccine.
It is a risk. So it is safe to give both together. But at the Hindu temple site, we took the decision to only give the COVID vaccine centre there because of the risk of it getting mixed up. The risk of having 2 boxes of vaccines on the table, trying to get through a number of people during the day, getting through a number of people during the day with a very similar contact point of explaining what the vaccine's about and what to expect afterwards and administering it. And the risk that in the course of the day, people would get mixed up and get the wrong vaccines, let alone the documentation on the computer systems, which has a complexity of itself. So at that vaccine centre, where we, as I said, we get through about 1,000 to 1,200 people a day, we took the decision to only give the COVID vaccine to avoid that risk. But if your vaccine centre is giving both, it is perfectly safe to receive them. If you're worried about it, then you don't need to, then you could just ask the person to give you the vaccine to just to be careful. Tell them you're scared, maybe play it up a little bit, you're scared about things getting mixed up, and then just make sure that, that you're all right. And also remember that if you're not registered with a GP, you can still get vaccinated. You can Absolutely. Go wherever you want for a vaccine. Boris Johnson, I keep on talking about him tonight, would like everybody in the country registered with the GP and with identity badges and all the rest of it. But we know that a lot of people in the UK who are not registered with the GPs, maybe don't have all the identity details that the government would like us to have. You can still get vaccinated. And everything is set up to support people who want their vaccines and not be too heavy on the paperwork to go with it.
And no ID.
We'd still give the vaccine.
Absolutely.
Perfect, thank you. And another question we've received is, what is the borough doing to get those that are homeless and sleep in rough shelter and off the street this winter in line with winter wellness?
So some initiatives along with the home and the shelters, some plans to do it for the homeless shelters which are opening up over the Christmas period, doing everything we can to identify people, go out to them, reach out to them through the local teams and make sure as much as possible they get vaccinated. Very, very vulnerable group of people homeless and a growing number of people as we know across London. So doing all we can everywhere and as much as possible to push out the vaccine and get the vaccines done.
Amazing, thank you. Once again, studio line is 0208 963 9566 if you'd like to get involved in the conversation. Socials are W1036 FM across Instagram, Twitter and Facebook. Our conversation is winter wellness, especially here in Brent. And of course, we are discussing flu jab, booster jab, COVID-19 vaccine, and obviously the low uptake in the Black community. So was there something that you were just about to say, Neil, before I interrupted you?
Yeah, and I just wanted to say that it's of no, this is, if you're a resident, if you're like at the end of the chain and you're making use of a service, then it's not going to hit you, yeah? And you just want to know you can gain access to a GP or you can actually get a vaccination at a place at a time which is reasonable for you, yeah? But I was going to say, and Nigel, I know, alluded to this earlier, I think, is that, of course, as we always point out, is that vaccination is actually not ultimately a matter for Brent Council or for Nigel and the primary care networks in Brent. It is a National Health Service-led initiative, yeah? And I would like to pay tribute to the local NHS, local council, and many community and voluntary organisations, whether that's organisations like mosques and temples who've hosted, or the many volunteers, yeah? It hasn't always been obvious when sufficient vaccine was going to be made available, and there have been different messages. I personally would like to have seen over 18s made a vaccine made available to over 18s much earlier than the announcement this week, and so on. Yeah, so we have to work within the rules and arrangements which the National Health Service, ultimately managed by government, puts in, and we are then trying to deliver. And my colleague and our officers and doctors and health staff are working in very difficult circumstances to deliver this.
Perfect, thank you so much. If anyone has any questions or would like to contribute, feel free once again to send a message through the chat that we currently have running on Zoom. Studio line is 0208 963 9566, and the socials are the Beat 1036 FM across Instagram, Twitter, and Facebook. The conversation today is winter wellness, and then we've touched on flu jab, we've touched on the booster jab for COVID-19, and we've also touched on the uptake being low in the Black community. And one thing that is also, I guess, something that is a pressing matter and something that people have been asking is, how can my GP help me without a face-to-face appointment? Because it's very difficult these days to get an appointment, especially when you need one, with COVID-19 being like the prime issue that is being faced by the health institution. So how would my GP be able to help me without a face-to-face appointment?
It's a difficult one. It's a really, really difficult one you've given there. Things have changed, and some things actually have changed for the better. So about 10 years ago, as a practice, we tried to do Skype consultations. We set it all up. We made sure that Skype was secure enough for NHS, for confidentiality and everything. And I had in my head that if you were, say, of a working age, it would be easier to tell your managers that you needed half an hour out of your workplace to take a call from the doctor, rather than take the whole day off, or sit in our waiting room for a morning, bored and sort of crabbing about how long the wait was. The uptake was absolutely minimally low, really terrifically low, and we just about gave up with it. With COVID, we started up again, but more on a national level rather than on a individual practice level. We're given new ziggy-zangy IT tools to do the video consultations on. And some of it's really great. It really depends what your Wi-Fi is like and what your handset's like. And if you've got something like mine, which is sort of old and crabby, it won't work. If you've got something brand new and top of the range iPhone or Samsung, it's brilliant. And many people do appreciate it. Many people do say, actually, it's a better way of working. It lets me stay in my home and not come out and risk getting COVID. It lets me go to work, be in my workplace and get things done and interrupt the day for 10 minutes, 20 minutes to have the consultation, rather than the whole effect of the waiting room. Not everybody likes it. A lot of people do like to be in the same room, and some of it's generational, that people of an older age group can't manage the technology so well, and people of an older age group aren't prepared to shift and change the way maybe people of a younger age group are. The way we work is similar, but not the same as every other practice in Brent. We take telephone calls, and everybody who rings in, we speak to. And from the people who ring in, we say, well, first of all, we can sort it out. People are happy both ways, us and the patients or people who've rung in. But some, we are saying, we need to see you. And as a practice, we bring in a lot of people. And as much as people feel that we're not seeing enough patients, we're not seeing people and bringing them in face-to-face enough, the numbers indicate we're actually seeing more people than we did before COVID. So yesterday, I had 62 patient contacts, which was predominantly telephone, a number of face-to-face consultations, and a number of emails coming in. And 62 patient contacts like that, at that level and that intensity, is something I could not have contemplated pre-COVID. When I was seeing people pre-COVID, I was booking in for 10-minute slots for people for about 3 hours in the morning, 2.5 hours in the afternoon, which is about 5.5 hours of the working day spent with people. And that added up to about 30 people. Someone in this meeting can probably do the arithmetic, maybe about 30 people or less than 30 people a day. So now I've got contact with 62 people, and I'm seeing quite a substantial number of them. And I think our practice of medicine is effective. It's also taught me something. I used to wait for people to come to see me. So a lot of it, I'd see people and say, well, something's going on, let's do some tests, we'll see each other in another week, another 3 weeks, another 3 months. And it would depend on them making the appointment to see me. Now with the telephone contact, what I found is something which I never contemplated before, probably out of habit, of making lists of people, using diaries, and bringing people and say, I spoke to you a couple of big weeks back. You weren't so great. This is what we did a couple of weeks back. And is it working? How are you now? And for many people, it's a very vivid and worthwhile conversation. So I'm actively following up people. I think in many ways I'm working much better. But I couldn't do that if I was following up people and say, you must come here. First of all, a lot of people would not turn up because on the day they'd be busy. And I can grab people for 10 minutes. It's sometimes only 3 or 4 minutes on the phone, but it can be a very effective conversation. So it has its benefits. It's a new fashion. It's a new way of working. It's a new way of living. There's a group called Health Watch who like to be the voice of patients. Not everybody's heard of them, but I was given a copy of a survey which they had done in Camden for some reason, which is the survey people really appreciated the phone calls and the videos. They really liked it. The majority, not all, but there was a very big appreciation for that sort of service. We're working with Brent, which is both the Borough Council and the Health Service, about what to do over the winter. And we're putting a lot of plans in place to increase further the number of appointments that we can offer. And it's difficult, the workforce is stretched, but we've been promised a little bit of money to try and bring in some more people. A lot of these will be increased telephone calls, video call sessions. So not everyone appreciates it, not everyone likes it. I'm not sure I necessarily like it, but I think in many ways I'm more effective with this mechanism of communication.
Thanks. And we do have a couple of questions in relation to the vaccine and family planning and pregnant women. But before we get into that, we actually have a comment that says that someone actually prefers the remote system because they don't have to go out in the cold. The GP phones them at home and they feel like it's much better. I have a question that's been submitted. If COVID patients come into your surgery, you could all get ill and your surgery would close. Isn't it better to be open and see patients remotely?
We do have to see patients. We can't do everything over the phone. We do have to put hands on people and get stethoscopes out. We do have to do that. We've got people who've had operations, who've had injuries, who need dressing. The nursing team is busier than ever trying to cope with that sort of work and take blood tests on the diabetics who need monitoring and people who are ill who need the tests and investigations. There is a risk of everybody who comes into the practice giving us COVID or picking up COVID in the building. There is that risk here, and we've had some scares and some incidents over the past 18 months, 2 years. Last week, one of our doctors spoke to a patient on the phone, a 15-year-old boy and his family, and was worried from that conversation the child might have meningitis, which is a life-threatening disease. Brought him up to the practice and examined him, was sufficiently concerned to send him down to emergency at St Mary's Hospital, where they assessed him and they did a COVID test on arrival. They examined him for meningitis and thought he did not have meningitis, and they're happy for him to go home, but he had COVID. So this guy, this 15-year-old, had come into the practice and been seen here. We had to identify everybody he'd had contact with, and we had to send the doctor home and away for 2 or 3 days before allowing him back in under the rules appropriate for the doctor who'd had triple vaccine at that point, and the contact that he'd had with his patient. We've had other incidents over the last months with people getting quite ill from COVID. People working here getting quite ill from COVID. We had at one point split teams, so a morning team and an afternoon team. So if one team went down, at least we'd have some people on the site. We've got a lot of backup from our network. Within Brent, there's 3 major networks, one in Kilburn, one called Harness, and one called K&W, Kingdom and Wilson, which is where our practice is. And we set up an infrastructure very early on for what to do if a practice went down, how to look after the people who are members of that practice through another practice, get the electronics linked up, get people in place, get teams of people working from their homes, working out the building on remote, so as to limit the people having contact in the building. It's a risk for us, it's a risk for you to come here, but sometimes we've got no choice. We do have to see people, and we will see people. And I don't know if I could throw in that our practice featured on some report as seeing more people than most of the other practices in Brent, just like the way it goes. But we do need to do that. Where possible, we don't. Where possible, we do it over the phone.
Amazing. Thank you so much. And there's some good questions here in relation to women that are expecting or pregnant. And over the winter, if it's worthy of them to get the vaccine or flu jab before during winter, or if they should wait until they actually give birth. What would you say?
Pregnant women are high risk for flu, high risk of COVID, and we've been recommending flu on pregnant women for many years now. And for COVID, we recommend very strongly COVID during pregnancy. It's a particularly high risk group, particularly high risk time. Many pregnant women have had it. Some are very scared and have refused, but many pregnant women have had it. And I don't know of any reports where a pregnant woman who's had it has come into trouble. There have been reports in other groups of people who have been vaccinated and had problems afterwards, but I haven't heard of any pregnant women who had problems after the vaccine. So I'd very strongly recommend to get both the vaccines and get it sooner rather than later.
Perfect, thank you. Because I was just about to ask you if you would recommend at any point in the pregnancy in particular for it to be best for them to go for the vaccine or flu jab, or does it not matter at any point?
It doesn't matter. It doesn't matter. If you're pregnant, get vaccinated.
Perfect, thank you so much. Again, studio line is 0208 963 9566, and the socials are the Beat 1036 FM across Instagram, Twitter, and Facebook. We're currently discussing winter wellness in conjunction with the NHS and Brent Council, discussing the COVID-19 vaccine, flu jab, why the uptake is very low, especially in the Black community. If you have any questions in relation to how your GP can help you, whether it's face-to-face or not face-to-face, any questions at all, feel free to get in contact. And if you're on Zoom, continue to send through your questions and your comments, as I'll be reading them out as we go along. Perfect. So yes, we've covered so much so far. Relating to pregnancy, something that I've actually personally heard through the grapevine is that women that aren't pregnant, but when it comes to their menstrual cycle, apparently the vaccine actually affects their menstrual cycle. Is that just a rumor, or is that something that's actually been scientifically identified?
There's a lot of information I've heard. I haven't actually heard that piece of information. There's an awful lot of information out there. And some of it you pick up on because it's relevant to you. Some of it you pick up on because you happen to be reading it. Some of it you don't pick up because there's so much. There's absolute information flood. So I can't comment on that. I can't comment.
I guess a question I can have in relation to that is, how do we differentiate what is the truth and what information we can actually rely on? Because I think sometimes people might notice a slight change in something in their health, when it comes to their health or a lifestyle, and automatically relate it to COVID-19 when that might not be the cause. Well,
COVID-19 is out there, and we've got a very low threshold for recommending people to have COVID-19 tests. It's a cause of illness, it's a cause of low-grade illness, feeling a bit under the weather for a few days. It's a cause of high-grade illness, needing hospitalisation and intensive care. So especially people with vague symptoms, we always recommend a COVID test, and where we can delay seeing people because we think the symptoms are low grade, we always say get the test done, because if you are positive, it explains what's wrong with you. And if you are positive, it means you've got to isolate to stop spreading it to everybody else. Mix of symptoms, and this is where it gets really confusing: sore throat, headache, loss of taste, loss of smell, aches and pains like backache, tiredness, exhaustion, headache, not quite so much diarrhea, just a bit more loose than normal, feeling a bit sort of vague. The real thing to look out for is breathlessness, but many people just get some very mild combination of a couple of those things. I think it can't be COVID because I haven't got everything. I have got my taste, I have got my smell, so I can't be COVID. Well, no, it's especially these low-grade lingering things, which could be the COVID, and that means you're a spreader and a spreader to everybody else. So get tested. Two sorts of tests. Many of us will have the home testing kits called lateral flow, which are done in about 3 or 4 minutes. They're useful, but they're not that accurate. And if there's any risk at all, you're best off getting the PCRs. You've got to ring 119 or go online and book the test. There's lots of places around. You can get the PCR test on at drive-through centres, or you can get it posted to you, then you do the test yourself and post it back. From my own personal experience, I've heard this story a few times, that people post it back and never had a result. So we had a bit of a scare as a family just before Christmas. One of us had been in contact with someone with a cold and flu, and we got the postal one. We never ever got a result from that. But having not got the result and feeling a bit better and wanted to go back to it, we did the drive-through and got the result the next day on the text. So from my personal experience, I think to do the drive-throughs, but many people have the postal ones and seem to get the result.
Okay, perfect. Thank you so much. And as we are discussing winter wellness, we've obviously discussed COVID-19 vaccine and flu jab quite a bit. Are there any other piece of advice that you would give when it comes to making sure that we're looking after our health during this winter, other than getting the flu jab and the COVID-19 booster jab?
For myself, I don't know what Neil thinks, I reckon that people should stock up a lot of food because there are going to be those bad, cold, freezing days with ice. And especially people who are a bit older slip on the ice and break bones. Young people slip on the ice and break bones, but older people are more vulnerable. Make sure your heating's working, make sure you had your heating serviced. Make sure your phone's working just in case things go horribly wrong. Make sure you've got a couple of people to call you each day. I've got a close family relative in her late 80s, and she's got 2 mates, and they all call each other at 8, 9 o'clock in the morning. If there's no answer, then they start ringing alarm bells to other people, but it's their network. So it's not possible for everybody, but try and get some sort of network like that, some sort of backup of people to help you and check you. Make sure you get your medications in. Coming up to Christmas, you've got 4 days of Christmas and bank holidays. With everything shut, and pharmacies certainly will be shut apart from a couple of emergency ones, to make sure you get your prescriptions in and everything else that you need in terms of 4 days, with a few places open, but not a lot open.
Amazing. Neil, did you have anything that you wanted to add to that? Put your hands up.
I think Nigel's given a very comprehensive take on how to manage cold weather and unforeseen need. Yeah, I would just add, one of the a good thing of what's come out of the pandemic has been a feeling of community spirit, and there has been an incredible input and support, whether it's on a street basis, neighbours speaking to each other for the first time in years, through to really good mutual aid groups across the borough, faith communities coming together, food banks, people in food poverty being supported, and so on. And if you know someone who you think, don't be afraid to speak to your local mutual aid group if you know someone might actually benefit.
Perfect. Thank you. Thank you. We have a couple of questions that have come through. Someone wants to know a bit more about how online consultation works. They think it's called eConsult. Is that correct?
Yep.
Yeah.
eConsult is a newish system. We've had it in our practice for about 2 years. We certainly had it before COVID. And our website's been set up, as I think every practice in Brent's been set up, to have this eConsult facility. And essentially it's an electronic form where you put on it what's wrong with you. Hit the submit button and it gets to your doctor. If you're registered with us, it would get to our practice and sits in a folder waiting for one of the administrative staff or doctors to open it and look through it. So it's not an immediate response service. It's not to be used for medical emergencies or anything where you're scared that something awful is about to happen. that's 999, that's 111, or a phone call. We get in a number a day, and it's growing. We get about 20 to 30 a day at the moment. Some of my colleagues in practices across Brent insist that all communications must come through this mechanism first, and they talk about 200 or 300 a day. And they've got teams of people geared for that. We're not quite so keen to make it a must do. We still have phone conversations first where people want, and then they've got the e-consult as an option. Having read the notes on the e-consult, the doctor, the administrator who reads it will get a sense of what's needed. Some things are quite simple and straightforward. I need a repeat prescription. I need a continuation of my sickness note. I need a letter for work. I need a certificate that I broke a leg 3 months ago for an insurance problem. Some of them are more complicated. Some of them I am ill. I've got a rash. I've got pains. I've got aches. I think I need blood tests. I think I need x-rays. I think I need scans. Where we can, we'll deal with it on the e-consult and reply. Where we find it difficult, we'll probably telephone people and say, we need some more information. Or we'll just say, this looks really best that you come in, and we'll phone you later in the day and get you to and get you seen by one of us here. So we treat each one differently. So some of it's purely administrative. Some of it is results in people being seen. Very note on this sounds really bad, and actually you should maybe dial 111 or go to emergency. They come in 24/7, so we get them coming in at weekends as well. And there's going to be a longer delay when we get them at weekends. Some of us are a bit mad and try and work on Saturdays and Sundays to clear the backlog. Most people are a bit more sensible and say that they've got to stop to freshen and be ready to work through the week. But nothing off limits.
Nigel, can I just come in? Because I know I'm raising this as a local councillor. I'm very confident about using IT. And I had a very successful experience of getting antibiotics prescribed for a finger at the early part of COVID. And it avoided me having to go anywhere. And it all worked perfectly. And I sent my photo off, and the GP was able to prescribe an antibiotic, and it was picked up electronically from the chemist, and it all worked perfectly. Yeah, but I'm very aware there's a group of people who are not digitally confident. Yeah, and that applies both for them using IT. It isn't a question of can they afford a mobile phone. They may have a very good digital phone, but they're not confident about using it. Yeah. And when I hear, and when councillors hear comments like practices, not your practice, but neighbouring practices, are asking everyone to go in digitally, what do we do? I don't want to say there are some older people who are very confident. There are others who are most certainly not. What do we do when people don't have that digital confidence? And what do we do and sometimes for outpatients in hospitals who are now running telephone appointments when actually the person needs to be having a one-to-one in person with the doctor to make the that outpatient appointment effective? Do you have a list of people who you know really you shouldn't expect to fill a form in online?
We don't oblige it. We tell people they can telephone.
Yeah.
We don't make it mandatory for people. Working in Brent, it's a fantastic place. I find Brent such a challenge. We've got people from all sorts of different cultures, backgrounds, races, religions, languages, English speaking ability, skills, techniques. And working in Brent, we have to cater for everybody. We went on a summer holiday to Yorkshire this year. There's a much more sort of homogenous Caucasian society. And everybody speaks English as a first language, and everybody knows the rules and how to cross the road. We don't get that in Brent. And if we do make something obligatory, especially IT for age groups, people who don't speak English, it's not going to happen. It's not going to work for them.
And
So,
are the e-forms in other language other than English? Can you get an easy translation?
We've got a little bit cross that the service hasn't moved on. It was started about 18, 24 months ago, and we're working with a group within Northwest London management NHS teams called
Brilliant.
NHS Digital to try and get the whole system redesigned on a new baseline, different languages, different responses, different automation techniques, sort of things with voice technology for people who can't type or who take 200 years to type the word "and," let alone anything else. So things like this. So we hope to see a new system in the next 3 or 4 months, but these things necessarily always take forever.
Thanks for that reassurance.
Amazing. Thank you both. We have some comments here, and we've got a comment that says, great question about digital confidence, as they are all going under the radar and also they can't get through to the phone of their GP. I've got a question in relation to urgency. What if my condition is urgent? Can I still call?
You can call and you should call, but the demand on our system is absolutely massive. We're getting about 40% more requests for contacts a day, and we haven't got the workforce which has increased to cope with it. First of all, the number of qualified doctors who we could employ is very limited, and secondly, we need the funds to bring in those doctors. So it's really, really, really difficult. And there are complaints. We get complaints all the time. We understand it's both on a local level and a national level that people can't get through to us on the phone, and we're not happy with it. When people do complain, we say, well, if it's not urgent, then use the e-consult system. If it's not urgent, then maybe you can have a chat with the pharmacist. If it's not urgent, you can do things this way and that way. If it is urgent, you've got to go on the phone. If it's very urgent, that's 111 or 999. If it's urgent where you think that's not appropriate, then it's a long, long, long queue on the phone, and people get very cross with us. I've rung up 3 days running, and I've been number 30, number 40 on the queuing system on the phone. I'm not happy. I'm not happy. But I don't know quite what to do about it. As a practice, we've taken on more administrative staff, and we have been promised funding for more administrative staff by the NHS over the winter months to try and help with this. And they've identified a pool of people who maybe could be used to work in this, come into practices. It's not great at the moment. The system is very, very pressurized. The system is pressurized by our service, which is like double approach. One approach is people who feel ill and I need help. So that's like, I'd call that a reactive medicine. And one is people we know who are ill, who we reach out to and say, you need a checkup. We haven't spoken to you for a long time. How are you? You've got to come in for a test. And we're trying to match both of those and match it to the best of our ability. We're managing, but we are struggling. Our hospital colleagues have got a huge backlog on planned operations, a massive, massive backlog, and a huge backlog on outpatient clinics. We're told that the ENT, the ear, nose and throat service, has got a backlog maybe of about 52 weeks. So if we as a practice write a letter today to see you in their clinic, 1 year before the next appointment. So it's a real struggle across the health service at the moment. A massive struggle. We're all working really hard. There's a lot of exhaustion and burnout around, so we have to support the workforce as much as we can. And I'm grateful for every support we get, and we appreciate that many people are very frustrated with this, many people.
Yes, thank you. And a question leads on to support in the workforce. Would you accept volunteers? I'm sure many people would like to help. I wouldn't mind helping a few hours a week. Is that something that you're open to? Is that something that's currently there? Is that something that could work?
People have offered this before, and I've always had welcomed people who've offered this, but I've always had a bit of a dilemma that people who've offered to volunteer working alongside paid people, it doesn't feel right to me. If I'm doing the same work as a volunteer, the person next to me is doing exactly the same job I am. It doesn't feel like a healthy approach in an organisation. So it's something I must say I've shied away from, and not quite sure how to go ahead. We used a lot of volunteers at the vaccine centre. The vaccine centre has been terrifically supported by the Hindu temple community and others who come in, massively supported, as was the mosque and the church. A lot of local people came out to help with that. A lot of people were on furlough as well, so they were volunteers, but they were on furlough. There's other things going on with confidentiality. So anyone who works in an organisation needs something called a DBS check, which are those of you in education or health may know about, that you haven't got any criminal convictions. That takes time to come through. There's a lot of paperwork to do, and not everyone wants to do that paperwork. So there's a lot of areas on that which slow things down. It's something which we're grateful when people offer, but never quite sure how to proceed on. But maybe I'll take that up with the local NHS managers, because that's their job to go and work out the rights and wrongs and the processes and the policies and the documentations and the and all the assurance mechanisms. So thank you. I'll take that back to the managers when we next have a meeting with them.
Perfect, thank you. I've got a comment here. It actually made me giggle inside because it's quite true. But there are a lot of alternative, and I say alternative in quotation marks, medicines in African and Caribbean elderly communities, which have been handed down from generation to generation. Would you discount these as alternatives?
I don't know much about alternative medicine. Alternative medicine exists across the world. In China, there's something called Chinese medicine, which is widespread across China. And many of these things are effective. Many of the things we use in medicine come from things used as herbal remedies. And the scientists have gone out to identify the active ingredient and then quality control it, so you're only getting the right number of milligrams rather than whatever may be vague in that leaf or tree or bark or animal venom or something. They have use. I think you've just got to keep your ear to the ground that you're buying from a reputable trader, from a recognised, I prefer a shop rather than a market stall. When it comes to unobserved, unregulated people, you can't quite be sure what you're getting. I've got no problem with herbal medicine in general, but it's just what might be in there when you're getting it from some unlicensed people on street corners. You just can't be sure. That's where I get nervous. And with Chinese medicine, going back about 10 years, there was a scare with one of their medicines that it caused kidney disease. It wasn't a scare, it actually was worked out that it did do it. And the Chinese medicine people just withdrew it. As soon as they realized that was going on, it wasn't safe, they just withdrew that Chinese medicine. But now we've got people from all over the world, so be careful where you get it from. And if you're not getting better on the Chinese medicine, please seek medical advice. Don't stick with it. Even if you don't like that advice and you reject it, just get the second opinion on what to do.
Fantastic, thank you. And as we are discussing winter wellness, we should also touch on children. So the questions come in relation to schools. Are schools doing the right thing responding currently? I have heard that they're going to close early. Is that something you would recommend they should do?
I don't know what Neil thinks. I think that's more of a government decision based on population numbers and who's getting ill. It's difficult. It's a difficult shout. Do we want the kids educated in a community of other kids learning how to live and be with other kids, or do we want them locked down at home with all the troubles with mental health that can happen when people are on lockdown at home, as it's happened over the last few months, and is quite well documented. I don't know what Neil would say on that.
I would completely agree with you. We don't actually have control. That is a government decision. I mean, I personally think we should have had Plan A. I don't think has been working for some time, and I'd far rather we'd gone for for mask wearing rather than ending up in a situation where schools may have to finish early. The damage to young people is incredible. I'm not sure what the age range on listening in today is, yeah? But I know that young people have had a really rotten time in the past couple of years. And there's an incredible tension about maintaining education, providing opportunity for people to be in schools, and at the same time addressing COVID management. I just wish we weren't in this position, and I think it is actually avoidable in England.
Perfect, thank you so much. And touching on how young people have been affected in the last couple of years, of course, their mental health has also been affected. And when it comes to winter wellness, we all know how things like SAD, which is seasonal annual diagnosis or something like that, So basically,
It's the only way
was I right? Was I spot on, or did I get it wrong?
Close, yeah.
Close enough.
Yeah.
It's sad. We feel,
Yeah, we feel sad. Do you know what I mean? Because it's cold, it's dark. We're leaving our houses when it's dark. We're coming home when it's dark. What kind of advice would you give us to make sure that we're keeping on top of things during this season?
I think physical exercise. I think people sometimes see physical exercise as being mandatory gym. Yeah, getting out during daylight, I think, is really important to get some physical exercise. Maybe just be walking. Just just reserve some time in the day for yourself, and music. And we've all got all sorts of pastimes. Yeah. But I think also about getting some regularity to the day is really important.
Amazing. Thank you. We have another question in relation to GP. What's your view on GP apps like Push Doctor? It's an alternative which they sell by saying see your doctor today compared to calling your GP and getting an appointment if you're lucky this week or maybe next week.
They have a use. They have a use that they can offer an immediate video consultation or a telephone consultation. There's one or two which are run by the NHS. The one I know run by the NHS is called Babylon. It's based in Hammersmith. It is very good at the quick decision, but not so good, in my view, at the things which need a bit of work over a number of weeks and follow-up. So if you've got a respiratory infection or a finger infection, as Neil was just saying, a decision on whether you need an antibiotic, and if you're not better, we'll call us again, but hopefully you will be better. You sound like you're very, very ill, go straight to emergency, goodbye. You sound like you've got a snotty nose and a cold, nothing to worry about, and if it doesn't get better, then this is what to do. But if there's long-term things like I've got a tummy pain and we decide with you that you need some tests and investigations and wait for those results, which can come back sometimes without showing anything, but we know something's going on, we want to do some more, that something's picked up, which is a long-term condition, say your problem with the kidneys or with diabetes, they're not so good at monitoring those sorts of conditions. They're not so good at providing the proactive health that we try and deliver, like for children and babies, for routine children vaccines, and monitoring new births and new babies, seeing women through pregnancies. They have a lot of advantages, but not the scope and range of work that we do in traditional general practice.
Perfect, thank you. Councillor Neil has actually posted a link in the Zoom chat, which is the latest vaccination info. So if you're currently on Zoom, check it out. And we'll also be posting it on social, the Beat 103.6 FM, across Instagram, Twitter, and Facebook. So make sure that you're following us on there. Before we continue our conversation on winter wellness, I actually want to invite Pat from Advice for Renters, who is hosting a fuel poverty awareness event at Civic Centre this Friday. So yeah, Pat, talk to us about your event this Friday.
Well, we've spoken a lot about the various elements of winter wellness, but one that is equally as important, vitally important, is fuel poverty and the consequences that has on people's wellness during the winter. I mean, cold homes kill, make no doubt about it, cold homes kill. So we've got 33% of people in Brent that live in poverty, and that's higher than the average, the London average. We've got 4 in 10 children that are living in poverty. So if you imagine an average classroom of 30 children, that's 12 children going home to food insecurity, no heating in their homes, and God knows what else. In Brent specifically, we've got 1 in 5 households who live in fuel poverty. So there are many elements, the combination of factors that actually create fuel poverty. We've got low income households, we've got unaffordable energy prices that are just escalating. We've got very, very old housing stock as well, which is very difficult to heat. It's expensive to heat. If you have an energy performance certificate, which is graded at F or G, that you're going to spend so much more money heating that home than a more energy efficient home. So we've got over 4 million households that are likely to be in fuel poverty this year, and that figure's likely to rise. So if your home's cold and damp, your health is going to suffer. You may be more susceptible to diseases such as increases in blood pressure, the common cold, right the way through to heart attacks, pneumonia, and even your mental health. So the last figures I have, in 2019, it saw nearly 50,000 excess winter deaths. Now that was an all-time high, or the highest figures achieved in 43 years. And again, this year, energy prices are set to escalate for many people. But if we break that down, what does that actually mean? So if the average heating, or what's considered sort of standard heating for a home, is between about 18 and 23, 24 degrees, and that offers no risk to healthy people. If your house temperatures drop down to 16%, then you may have a diminished resistance to respiratory infections. At 12, I beg your pardon, centigrade, at 12 centigrade, in that temperature for 2 hours or more, your core body temperature drops and your blood pressure rise, and you have an increased viscosity as well. If your temperature in your house drops to below 5 degrees, your deep body temperature falls. There's significant increases and significant risks of hypothermia. So again, cold homes kill. Okay, but this year, as we know, we've had this massive energy crisis. We saw an increase in the price cap, the energy price cap. The people that are likely to be hit hardest, apart from those on low income, are those that have been very, very savvy shoppers and have managed to fix in on a low rate, low tariff. So when that tariff ends, the cheapest thing they're going to get is the energy price cap, and that's going to be a significant burden to their finances. Okay, so Advice for Renters are hosting an event, as you said, at the Civic Centre this Friday, and it's designed to help anybody that's struggling financially to pay their bills. Yeah, nobody should have to choose between heating or eating. No child should have to go to a cold home. No pensioner should have to spend, the winter sitting in a cold home. It's not good. So we have a number of organisations who will be there. I believe at the moment we'll be in the atrium of the Civic Centre on Friday, the 3rd, between 10 o'clock and 3 o'clock. We have organisations such as National Energy Action, who are a lobbying organisation. They will hopefully be bringing down some energy freebies, reflectors, LED light bulbs and such. We have the Green Doctors who will be coming down to provide specialist energy advice to help people sign up to schemes, grants and various discounts which they may be eligible to. We have Brent Council who will be representing to talk about their CO2Go carbon offset fund, where clusters of households can actually get together to bid, if you like, for grants to actually improve the energy ratings of their houses. We have the NHS social prescribers coming down to talk to people who may be vulnerable, have vulnerabilities with regard to their health. We have Stream Skills who'll be coming down to offer their support for people speaking Arabic and Somali. We have Age Concern, Ashford Place, Shore Trust. So we've got a fantastic cohort of energy specialists to help people along with their vulnerabilities to make sure that nobody goes cold this winter, that we keep these winter excesses deaths down as low as we can. So that's this Friday at the Civic Centre in the atrium, very well socially distanced, so please come and see us. And what we would like you to do if you do come is to bring either details of your current suppliers, whether that's water, gas or electric, or bring some old bills with you so that we can get those details so that we can help you get signed up on the spot for the various discounts and schemes that are available. So look forward to seeing you then. Thank you.
Amazing. Thank you so much for sharing that. We've also got a comment in Zoom chat which says, great initiative, Pat. Thanks for organising this much needed sessions. It would have been nice also to have this over the weekend to encourage more attendance, as many people may be working on a Friday between 10 a.m. to 3 p.m. Yes, I was just about to ask you to send a link over so that people can click on it and be forwarded
I
today?
have. There's full details in that link, and there's also the contact number to our energy specialist. So if anybody can't make it down on Friday, then please, please, please do ring us. We're just at the end of the phone, and we can refer you to any of the other specialist agencies.
Perfect. And for our listeners, what are your contact details in terms of any social media networks, your telephone number? What can you give us today?
Right, what can I give you? Let me find that. So the best contact will be our switchboard, which is off the top of my head 0207 624 4327. That's 0207 624 4327. That just threw me just then. I hope you managed to pick that up. Our email address is money@advice4renters.org.uk. But if you just Google money advice for renters in any format, whether you use the number or whether you use the words, you will find us. But we'll make sure that our details go out in the description to the YouTube event, so you have access to that.
Amazing. Thank you so much, Pat. I want to encourage anyone who has any questions or last minute questions for us, especially for Neil, Nigel and Pat, to either call in on 0208 963 9566 or hit us up on the socials, the Beat 1036 FM, or send through your questions in the Zoom chat right now, and I'll read them out, or any last comments that you have. I actually would like to thank all three of you for contributing today. It's been a great discussion where people have been able to learn a lot. This conversation will be available on YouTube, and I'd just like you to share your final thoughts, just in case we have no questions that come through last minute. Your final thoughts. Who would like to go first? Nigel, would you like to go first? I can see you're smiling.
Well, thank you very much for inviting me onto this programme tonight. I really enjoyed being here. I hope that I've contributed well. Winter in England is bad news. Not quite sure why we want to live in England with all the bad weather we get this time of year, but we do. Well, we've got to be careful, be safe. Thank you.
Amazing. Thank you so much, Nigel. And yourself, Councillor Neil?
Yeah, I'd just add, going back to what we said at the very start of the programme, get vaccinated, first, second, third, get your COVID vaccination, get your flu vaccination. And there's and if you're having a hard time financially, look at the Brent website, look to see about the Brent Residence Fund, and make use of and get in contact with mutual aid. And I'd also add, which I'm going to share information about what the council's doing in terms of a whole range of library activities. I'm very aware that people don't always want to go out, and that going out is a personal choice, and that there's a lot going on which people can actually watch and do from their homes, and participate in activities. And I'm just going to put those up now.
Perfect, thank you. And I also encourage everyone that's currently in the Zoom to share any information or details from our conversation today on winter wellness that may help other people. If you'd like to share your contacts as well, people to network and stay in contact with each other. My manager's going to keep the call open for just a little while, so make use of it, and feel free to scroll up as well to find any links that you may have missed that may be of use to you. I want to thank you all so much for joining this conversation. It is important for us to stay healthy this winter. Winter's barely begun. We're just entering December tomorrow, but it is cold outside, and we do have this matter when it comes to COVID-19 flu. We've had great contributions and information shared from both Neil and Nigel today in relation to the booster jab, flu jab, and so many services that are available to you. If you would like to watch this or listen back to this, this will be available on YouTube. Make sure you're following us on the socials, the Beat 1036 FM across Instagram, Twitter and Facebook. I've been your host. My name is Claudia. I am the Breakfast Show presenter here at the Beat London, and it has been an absolute honour to host this. I love hosting this. We'll be back next month in conjunction with Brent Council again for another conversation. So thank you guys so much for joining us today. Thank you guys.
Thank you very much.
Thank you.
Thank you.
Great. Thank you.
Thank you, Nigel. Yeah.
And if you are struggling financially, please do get in contact with Advice for Renters or Advice for Renters Money. We actually work very, very closely with many of the agencies that Neil just mentioned. And we like to think that we provide a wraparound whole person, whole community service, rather than just referring people hither and thither. So please spread the word. We look forward to helping you at our event, and I can't wait for a day where we are completely redundant and you don't need any help. So we look forward to seeing you on Friday.
And thank you, Claudia, for hosting. Much appreciated.
Very much, Claudia. Thank you.
And good luck, Pat.
Thank you.
Good luck, Pat, on Friday. Thank you.
Thank you ever so much.
Thanks,
and cheers. Stay safe, everyone.
Evening. Yes, and have an amazing winter. Thank you.